For more than 2 decades, Somalia has been in turmoil. Men, women, and children have been killed in the thousands, and several 100,000 have left the country, leaving behind little infrastructure and virtually no healthcare systems in place. There are a few working hospitals. However, the majority of the country's health workers lack even basic training. IOM works with a wide range of people, including migrants and mobile populations. These are people who are frequently on the move, sometimes against their will, such as internally displaced people, IDPs, consisting of women, children, and the elderly. Committed to the principle that migration is for the benefit of all, the International Organization for Migration, IOM, continues to strive to make a difference in the lives of migrants around the world. Established in 1951, IOM is the leading intergovernmental organization in the field of migration, working closely with governmental, intergovernmental, and non-governmental partners to assist immigrants and help build dialogue between nations to ensure an orderly and humane response to the challenges and opportunities presented by human mobility in the 21st century. IOM has been in Somalia since 2006, implementing a range of programs and projects that are targeted to assist the more vulnerable migrant and mobile populations in the country and host communities. IOM provides comprehensive assistance to mobile populations affected by the devastating Horn of Africa drought in 2011. In addition, through strengthening capacity of security at the border and port and border management, IOM is supporting the safe and orderly migration of people.
In 2011, the worst drought in 60 years devastated Somalia, and many people were displaced. IOM is implementing a livelihoods project aimed at providing food security for these internally displaced peoples, IDPs, and their host communities. A new parliament was established in September 2012, and many IDP are expected to return to their places of origin due to stabilization of security. IOM continues to provide sustainable assistance aimed at long-term development in Somalia.
The central government has limited control over all of Somalia. Smuggling, including human smuggling, is a major concern. Fear of terrorism is also increasing. IOM is providing assistance to the governments of Somalia to enhance border security and immigration processes. Another intervention we are involved in is counter-trafficking. We are raising awareness about the dangers of human trafficking through radio programs. Somalia is in transit from a country with weak security and political systems to one of political security and stability. There are people in the government, among local NGOs, and in the general population who are working hard to make their country better and safer. We would like to continue working with these people to offer effective and sustainable assistance. IOM's health division in Somalia was established to improve the health conditions of the country's migrants and mobile populations. Since 2010, the Migration Health Division has been running activities to improve the health status of migrants, mobile populations, and their host communities in close partnership with parallel government ministries, community leaders, religious leaders, and Somali-run humanitarian organizations.
The long-lasting civil war and continuous natural disasters have left scores of people displaced and living in dire conditions. For example, many internally displaced persons make their homes in settlements with no light at night, and many cases of sexual and gender-based violence have been reported to occur when the sun goes down. IOM is distributing the solar lanterns to these IDP settlements to prevent sexual and gender-based violence, SGBV, in collaboration with Panasonic Corporation and funded by the government of Japan. This solar lantern is very easy to carry, which is beneficial to the IDPs, who frequently move to other locations. IOM is implementing assistance that matches the need of mobile populations. Additionally, internally displaced persons are often living in very congested, unhygienic conditions, and various infectious diseases are easily spread. In coordination with Nippon Polyglue, a private Japanese company funded by the government of Japan, IOM is distributing clean water to these internally displaced persons.
This kind of partnership between government and private sector is called Public-Private Partnership, PPP. It describes a government service or private business venture which is funded and operated through a partnership of government and one or more private sector companies in order to realize better services by tapping into the private sector's financial, technical, and operational capabilities. Recently, many international organizations and governments have started using this method. It has proved effective and efficient in tackling development challenges and is starting to attract attention around the world.
For 21 years, Somalia has been suffering from civil wars and natural disasters. Over the years, many bright and experienced Somalis from different sectors, including public health professionals who could have taken a lead in the country's development, have left for other countries. Now, capacity building of the limited human resources that exist is urgently needed. On the other hand, over 2 million people are still in crisis and in need of ongoing emergency response assistance. We would like to request for further support from the Japanese government and the international community.
For the first time in 22 years, Somalia has a recognized government with a new president, prime minister, parliament, and constitution. Many people are expecting this will boost the reconstruction of the country. The financial and technical support of the international community are key to the stable development of this country. The International Organization for Migration's activities are helping the government, local leaders, and communities deal with the repercussions of heavy movement of people. Because of its strategic position, what happens in Somalia has a large bearing on the Horn of Africa's stability. IOM will keep supporting Somalia's stabilization and development.
gabadhu waa idilo geesi uu dhalay